while Bello et al., not my humble self here, Bello, another researcher, also conducted a research on seropolium with large number of sheep and goats, about 4,000, and then about 17 gazelle, which are the wild ruminants. And he came up with 61.1%, so we could see. And then our able Mantip here, Dr. Mantip also, who has conducted a lot of research, he did the isolation actually using the reverse transcription PCR, and came up also with about 27% viral particle isolation of the disease. So we can see it's a disease that has a very wide seroprevalence, ranging from 20-something to 60-something. So the economic impact, as I said, according to the Ministry of Agriculture also data 2017, the annual financial loss is about 50 to 65 billion naira. So if I, by rough estimate, to be converted into dollar, that is about 120 million US dollars. That's for Nigeria. So this is a huge amount of money for household, and considering the fact that majority, large number of sheep and goat are kept in the rural areas. So it's a very, very big loss. And this is loss due to death alone. And the estimate is about 10,000 naira per animal, which is at the lowest side, I can say. So I would like to refer us to the national strategy for the control of PPR. It is on the net. It's a very, very comprehensive document that was put up with the participation of all stakeholders, the FAO, the OIE, the AU, the IBA. So we can check this document for reference. And so this is, of course, I think it was earlier presented by Mantip to show us the spread all over. Disease is actually spread all over the country. No part of the country geopolitically where the disease has not been described. So the prevention and control strategy, I think, are well described. We have the global strategy for the control and eradication of PPR by the OA and FAO. That is 2015. That took place in Cote d'Ivoire. And then the target is by 2030, there should be full eradication of PPR. And we intend to use the experience by the rinderpest, and that's the connection between the morbillivirus of rinderpest and this. So since the behavior of the viruses are more or less the same, so that experience can be used to see if that target can be achieved. So as mentioned also, we need strong veterinary structure and legal framework, vaccination of up to 100% vaccination of all animals older than 3 months, and then at farm level, there should be at least 70% control. And then, of course, as I said previously mentioned, strict transboundary disease control of animals. So when it comes to the research gap, just the research in PPR is not different from other researches. So lack of adequate funding, especially in the maybe African situations here, lack of diagnostic tools, because I can say in the whole of maybe northern Nigeria, the only reliable perhaps place where you can have good diagnosis regarding PPR is only VOM. So you can see the issue. So most samples have to be shifted to VOM, and then manpower also and skills. And then one of the other things, also a big gap, is that most researches tend to end at the shelf of the institutions. So I think there should be a synergy between the academia and the industry. And then also a very important thing is how to persuade the rural stakeholders to cooperate in the vaccination and other measures for eradication of the disease. What I want to present here is my practical experience. So before I joined the academia, I was a clinician in a town clinic and a consultant to a private farm. So I'm very familiar with what is PPR. But one of the most amazing things that I want to share is when I had, before I had an outbreak in my farm. I do keep antelopes for more than a decade now. They call them the gray or common antelope. So, and they came down with PPR in 2015 in my house. So actually, these are some of the few things we documented. These are the dead animal. You can see the lower sorry to say, diagram below showing around the anal region, smashed feces. So we conducted post-mortem examination here in the faculty. So this is the animal after death on the post-mortem table. So on opening, we found the lungs, of course, the trachea well congested. So this lung is not healthy as we can see. So, and this is the tongue. Permit me to go to normal view so that I will expand. We see really the lesions. If you can see some of the lesions on the tongue.
Professor Bello, you have maybe 1 or 2 minutes to
okay, sorry,
to wrap up.
Okay, sorry. So this is you can see the upper palate. You can see here. So it's really a very classical picture of what is PPR. So this is almost pathognomonic stripe, zebra stripe. And well, so that is what I feel I should share regarding the wild ruminants. And the importance is that if you go to, for example, Yankari Game Reserve, you find a lot of herders with their small ruminants, sheep and goat, mingling with this small wild ruminant. So this is very important also when it comes to the epidemiology of the disease. When we are talking of eradication, we have to put into cognizance also the wild aspect. So I just conclude this in big one sentence, that is, for us to achieve this eradication project, there are each and every stakeholder, starting from the rural stakeholders and the government. So this is maybe what I have to leave us with, and then thank you for your attention.
Thank you very much, Professor Bello, and sorry for rushing you and for the short notice for the presentation, and very much appreciate that you could manage to do such a great job in a short time.
Actually, sorry, I wanted to caution you. It's a long time because of some industrial action. We didn't give lecture. I wanted to caution you, if I should talk too much, you should stop me. So
yes, well, that's why hopefully yes. But it's great. You managed very well with the time. So yes, unfortunately, with all the delays and so on, we have only maybe 10-15 minutes to share a bit more from this. But we can really see from all these very interesting talks on research done in different states and so on that we have more or less actually results quite similar about high prevalence and issue with knowledge about the disease and what to do when there's a disease outbreak in the communities, the need really for community animal health workers, really the risk represented by animals that are infected being sold in the markets, and it's really linking quite well with the results of Samuel Mantip, showing the diversity of virus strain you can find at one single time in one market. It's because I guess it's coming from different places in one spot. So from there, I mean, we can see that as Professor Bello was saying, there is research. Sometimes there's not enough information communication about this research. Sometimes some of it, is published. That's but from there, does it go back to the communities? Maybe it's something that would be very important. Is there more communication among researchers to really find what is the next question about PPI in Nigeria. Because in terms of research gap, what I had in mind is more to know, but what is really the most important questions that maybe different universities and research institutes in Nigeria should put their efforts together to answer to really help with the control effort. So we had